Good evening. Today we'll discuss one of the most commonly asked question to a nephrologist is when to start dialysis in CKD patients, and once I start on dialysis, how frequently I need to do dialysis. Regarding the first question, when to start dialysis in chronic kidney disease patients. Now, as you all know, chronic kidney disease patient is a chronic ailment, and they're suffering from kidney disease for quite some time. These patients generally present to us in two different scenarios. One is the emergency scenario, where you'll have very high potassium contents and very high acid levels, and they'll be severely breathless because of the excessive water in the body. These are the indications for emergency dialysis, and we do dialysis in these patients irrespective of their creatinine and urea levels. The second scenario is where the patient is on regular follow-up with us, where we'll be monitoring the creatinine levels and other parameters for quite some times. And generally, when in these patients, once the creatinine goes above 5 or GFR falls below 20, we prepare them for dialysis by doing something called as AV fistula. In these patients, we look for symptoms called uremic symptoms, where it will be anorexia, nausea, vomiting, generalized weakness, and all these things. And even without the above mentioned symptoms, the emergency symptoms, with these symptoms goes up and the creatinine goes above 7 or 8, and with the symptoms we do advise dialysis to them. The second question is, once I have started on dialysis, how frequently I need to do dialysis. Now, most of the literature says that you have to start dialysis at least twice weekly, and based on your urine output, either 2 times weekly or a 3 times weekly dialysis is what is advised. Now, the latest concept is something called as incremental dialysis, is in patients who have early symptoms of uremia, like even with 3-4 creatinine. If they are having symptoms, we advise them dialysis once in a week or once in 10 days, and slowly increase the frequency of dialysis. But creatinine levels which are more than 5 or 6 and who are on regular follow-up, we advise them twice a week dialysis or thrice a week dialysis based on their urine output and other symptoms. So to conclude, there are two indications for dialysis. One is the emergency indication, the other one is the non-emergency indication. And once you have started on dialysis, 2 times weekly or 3 times weekly is what is recommended. The latest concept is the incremental dialysis.